So in this segment, we're going to be talking about thousands of NHS staff to leave because they can't afford to travel to work, chiefs warn. This is scary, especially given the staffing crisis in the NHS over the last kind of decade now. This will make things a lot worse. So thousands of NHS community staff who rely on cars for work will be forced to leave their jobs and pursue other careers as they cannot afford soaring petrol prices, chiefs have warned. And if they do leave these sectors, they may not come back, and it'll just cause a massive problem, especially in the long term. Community services could lose 8% of staff in the next year, with NHS chiefs warning that this will impact access to care for the most vulnerable children and adults, according to a survey shared with The Independent. Under the latest estimates for annual energy prices, workers on the lowest salaries will be expected to spend a third of their monthly income on fuel. That might sound like an abnormal amount, but these are people who are probably doing more residential care, going to people's houses or going to different care homes to look after people. While an analysis of the NHS data suggests that record levels of staff have already left their posts for better paid options in the first 3 months of 2022 already, it's happening. People are leaving more and more. As the cost of living crisis worsens, nurses have stopped making pension contributions in order to afford their home bills, and that's crazy because they're taking money effectively out of their retirement in order to fund their current living standards, whilst others are considering taking on second jobs, posing a risk to their well-being and the quality of care provided. I mean, people working full-time taking on second jobs, that's crazy. That's, the social contract has been broken, The idea that if you work full-time, you put the hours in, you should be able to have, a decent standard of living, that contract's gone. Matthew Taylor, Chief Executive of NHS Confederation, warned if NHS staff in the community can't afford to fill their tanks, then they cannot make important house calls and check in on some of the most vulnerable and poorly patients in our communities. And what that means is you'll have more and more people waiting for ambulances, more and more people in the hospitals because they didn't get preventative care, and that just puts further strain on the NHS. Trust leaders estimate on average 8% of the community staff, equivalent to 6,760 workers, across the NHS could leave over the next 12 months if the government does not improve its reimbursement scheme. And this reimbursement scheme is a joke. Currently, staff can claim back 56 pence per mile. The thing is, obviously, petrol price about £1.70, 80 per litre. It depends how efficient your car is. However, this figure has not increased since 2014, despite soaring petrol costs. Madness. The survey shared with The Independent found that staff are turning down job offers in the community which involve driving long distances in the countryside. So effectively, people that that live in more rural areas are not being looked after because the costs are just too high. Not the cost for the government, but the cost to employees to look after them, thereby reducing the sector's capacity to tackle backlogs of care and support safe discharge from hospital. It also means that if they need an ambulance, these ambulances are going to have to drive quite far in the countryside, and if they had preventive care, that might not have had to been the case. One community provider leader reported that some of their staff were already paying an additional £200 per month in fuel costs to visit patients, while another said increasing numbers of workers were calling in sick rather than admitting they cannot pay for travel. People are ashamed to admit that they can't afford to, go out and look after they're rather calling sick, and you only get a certain amount of sick days before you kind of get reprimanded for it. Lucy, a paediatric nurse at a leading central London trust, said that she was considering joining many of her former colleagues in moving into the private sector and had recently stopped contributing to a pension as a result of the living costs. And, the private kind of healthcare sector is getting a massive boom because the Tories have completely dismantled the NHS. It's payday in a couple of days, and she says, I'm at the bottom of 2 overdrafts on 2 different cards. I mean, that's madness. It's absolute madness. No one can live like that. She said it happens every single month. I'm hoping to see a bit of improvement now. I've stopped contributing to my pension. I didn't want to do that, but I felt like I didn't have a choice. People just in their overdrafts, not being able to pay in their pensions and things like that. It's just, why would you want to work in such a sector that does that? She's in, I think central London or London, really expensive place to live, and it's just so stupid, honestly. A recent poll by healthcare news site Nursing Notes found that almost half of nurses surveyed are considering ditching their pensions due to the cost of living crisis. And that pension money is meant to be invested and given back, or some of it's meant to be added on and given back to the people who pay into pensions. And it's just sad, isn't it? It's come to this. You got James, a nurse working in a West London trust, said he was looking into picking up agency work alongside his regular shifts. That means a 45 to 55 hour work week. That means he's coming home for the NHS already tired. He's coming home into work for the NHS already tired and overstretched. It's dangerous. But his options are limited. Here you have a person who his job, I don't know what specifically he will do as a nurse, but you have a person in a job role where because of their fatigue, they might make mistakes, and that could put people's lives at jeopardy. And you wouldn't be able to blame him for it, really, because he hasn't got a choice. He's got to make ends meet, and if he's not, if he's suboptimal in his work pattern, it's going to show, and people may get hurt because of this government's inability to help healthcare workers during the cost of living crisis. The Patients Association said NHS staff are leaving because they are worn out or they don't feel they are adequately paid, adding that without a full complement of staff across the NHS, the care provided to patients is unlikely to be compassionate and could pose a safety risk, which I 100% agree that I think that's going to happen. It's already happening to an extent, but I just... they're having staffing problems already. If you got more and more people leaving, it's just wild. And during the pandemic, you had the Tories applauding these people, saying, "Oh, these people are heroes," and blah blah blah. They're not heroes, but they do deserve to be paid properly. Let's be honest, now they do deserve to be paid properly. Let's not romanticize who they are. There are people doing a very very important job, but to make them heroes makes it out like they're selfless, like they don't deserve reward. They do deserve to be paid properly. And the fact is, this government are not doing that. And the more and more healthcare workers leave, the harder they'll be to replace, and the more long-term damage it does to this country. I just, I don't blame anyone for leaving. They can get paid more in other countries. I'd say they should do it because this country doesn't value them. We get the governments we deserve at the end of the day. We know that the NHS has been in crisis for the longest time now, and people still vote for the same idiots to be in charge. So who's that on us? If we lose the NHS, that's on us. It really is, because the Tories aren't hiding their contempt for it. Not really. Anyone who's stupid enough to believe that the Tories care about the NHS is stupid enough to vote Tory, and those people are just morons. Anyways, I'm going to leave it there. Let me know what you think in the comments below. Like, comment, share, subscribe. Support the channel on Patreon if you can, and hopefully I'll see you in the next one.